Hi, it's Congresswoman Terri Sewell, and I want to welcome you to a very special edition of Terri Talk. Today, we are here to talk about an issue that is essential for our rural communities, our rural hospitals. We know that our rural hospitals are already facing unprecedented challenges here in Alabama. But sadly, lawmakers in Washington are making the situation even worse. A few weeks ago, House Republicans passed President Trump's so called big, beautiful bill. And that bill gives trillions of dollars in tax breaks to the wealthiest Americans and pays for them by slashing health care and food assistance for our most vulnerable Americans. It is an outrageous attempt to further enrich the billionaire class at the expense of the working people of America. The bill cuts more than $800 billion in funding for Medicaid. Those cuts would strip nearly 14 million Americans of their health insurance and leave countless others without the food assistance that they need. We know that Medicaid in Alabama is a lifeline for so many Alabamians, especially our children, our seniors, and the disabled. More than half of all births in Alabama are covered by Medicaid. More than 68% of our nursing home patients rely on Medicaid, and more than 20% of Medicare beneficiaries rely on Medicaid. The list goes on and on. But Medicaid isn't just important for individuals. It is also a lifeline for so many of our hospital systems here in Alabama, which are struggling to keep their doors open. In 2023 alone, Alabama's hospitals received $3 billion in Medicaid payments. Now, because state officials have refused to expand Medicaid, Alabama already has a bare bone minimum at Medicaid program, which has only been exacerbated by the closure of rural hospitals throughout our state. But if Republicans in Congress are successful in passing Trump's big ugly bill, as I call it, our remaining rural hospitals here in Alabama will be forced to eliminate essential services or even close their doors altogether. At a time when our rural hospitals are already struggling to keep their doors open, cutting Medicaid would be a gut punch. We simply could not, cannot let this happen. While the big ugly bill already passed the House, it now sits in the U.S. Senate, and its fate will be determined by a few Republican senators. Now more than ever, we need to speak up and make our voices heard. Alabama's hospital systems cannot afford to cut Medicaid. Today, I am thrilled to be joined by Loretta Wilson, the CEO and administrator of Hill Hospital in Sumter County. She and her team work hard every day to provide quality, life-saving care to the residents of the Black Belt. They are on the front lines in fighting to save our rural hospitals, and I want to thank them for their tremendous efforts. Miss Wilson, thank you so much for being here on Terri Talk. How are you, Miss Loretta?
I am doing well. I am doing well. Thank you so much for having me today. And thank you so much for having this conversation. I think it's a conversation that we've had so many times. Unfortunately, we're still having to have this conversation around the challenges that we faced here in rural Alabama relative to keeping healthcare alive for those individuals who really, really need the services. So thank you for the passion and for your stance against anything and anyone who forces us to forego services for those who so
Who need
desperately.
it most? Absolutely. Absolutely. Well, like you, I'm a daughter of the Black Belt, and I know how important hospitals are to the economic viability of our communities. And I want to thank you for what you do for Sumter County and the Black Belt writ large. Hill Hospital has been a crown jewel to have right there in the rural Black Belt. Can you tell us how long Hill Hospital's been around and what kind of services you provide? And the
Well,
mix, what's percentage is Medicaid, Medicare? Can you talk a little bit about Hill Hospital?
so, the Hill Hospital was birthed by, I would say, Dr. Hill and his family in the early 60s.
Yeah.
The hospital have been here, I think it's been managed many years by many different organizations, many different individuals. And today it's being managed by the City of York Healthcare Authority. The hospital is based here in Sumter County, Alabama, which you know is one of the poorest counties in our state, among one of the poorest counties in our state. And the hospital is a licensed 33-bed hospital. We are authorized to operate 27 of those beds per the Alabama Department of Public Health. We offer acute care, outpatient services. We also run a rural health. We also run a rural health clinic, and our primary patient population include medical detox patients, which um, it's really been our niche for survival, to be totally honest with you.
Yeah.
We do provide lab services, we do x-rays, and we do some minor surgery, but not major.
Right.
That can be done within our ER. We're 24-hour ER services.
Which
So
is it's so important in rural Alabama where, oftentimes people have to drive an hour, 2 hours to get to a hospital. The fact that in Sumter County you have a hospital is truly a remarkable feat. And the fact that you guys, I know you're struggling, I know that, but I also know that with every struggle, the community always figures out a way to keep the hospital open. And it's made harder by a state that didn't expand Medicaid. Do you have a large portion of your patients that are Medicaid versus Medicare, and
yes,
that's dependent
yes.
upon government funding?
Yes, a large portion of our patients are Medicaid patients. As I mentioned, medical detox is one of our greatest revenue driver. And those patients who present to us, if they don't have Medicaid, they still can qualify for presumptive eligibility Medicaid, which is a 60-day Medicaid. And they can get 60 days of Medicaid. And so that has been like a lifesaver for us, because that Medicaid, or any Medicaid for that matter, is it's you can it's non I'm trying to find the word for that. It's
But the fact that Medicaid is a lifeline for so many vulnerable
yes,
individuals, and the fact that there's a presumption that you are on Medicaid
yes.
for those first 60 days ensures that you get the payment you need to keep your doors open and to provide the services, and that your patients get the care that they deserve.
And that's right. And the patient can stay, those patients, especially the medical detox patient, because they have Medicaid, they can stay in the hospital for up to 30 days.
Ah,
So
that's great.
that has been great for us. So that's
Absolutely. So, what kind of challenges do you face that rural hospitals in Alabama face because we didn't expand Medicaid? I mean, I think that what people don't realize, especially those of us who don't live in Alabama, is that Alabama, every state gets to design its own Medicaid program. And the state of Alabama has the most bare bone minimum benefits, and you have to be really, really poor in order to get Medicaid in the state of Alabama. I think that you have to earn less than $8,000 or something a year, and ours is a bare bone minimum. And if we were able to expand Medicaid, all that would do is give us a bigger pool of eligibility, of eligible folks that could get Medicaid, which I know would be a huge plus, especially for rural hospitals in terms of getting more, more funding.
yes. It's unfortunate that Medicaid was not expanded. It would have been a great life. It would have been a lifeline thrown to rural hospitals. And then the fact that because of that, we are still facing financial instability. I'll just we really are. And I just want to kind of say, kudos to our staff, because I came in 2024. I came in 2014. And when I came, the hospital was really, really, really struggling. So much so that one of the board members was actually paying payroll out of their pockets.
Mm.
And so the hospital staff, we got together and we said, hey, what are we going to do? And this is what we decided to do. We took percentages off of management. We took percentages off of non-managers. We start looking at, those things that were wasteful. We did those things so that we can continue to provide the services that were so needed here in Sumter County. So I want to say kudos to those individuals. Now, COVID gave us some reprieve. It gave us some funding. It helped us, sustain a little while longer. But post COVID, the funding has gone away, but the expenses they're still there. Everything increased across the board. So those challenges now, what we're facing again is financial instability, being able to compete with urban hospitals, with staffing, benefits, etc. A lot of hospitals are able to offer their staff bonuses. We're just not able to do that. A lot of hospitals are offering their employees retirement. We don't have that benefit, the luxury of offering at least a state retirement. We just don't have that luxury. So we're still having those challenges. And that's one thing that separates us from the urban hospitals.
Absolutely. And I know that in our district, we have 13 counties, and what unites our district, because we have Birmingham and we have the Black Belt and we have Tuscaloosa. And what really unites all of us is that my district is, has a lot of underserved communities.
Mm-hmm.
And what the rural hospitals like yours, like Hill Hospital, provide is, gives rural communities an opportunity to have a viable, quality healthcare right in their neighborhood, right in their community, and not have to drive. And so I wanted to just sort of share with you some of the numbers. I know you know that, but our listening audience need to know that, over 330 hospitals will likely be forced to close or scale back their services if this big, beautiful bill, and I know you know about it, the president's main agenda item is this reconciliation bill that would give a tax break to the millionaires and gazillionaires, but they do it on the backs of ordinary people. In order to pay for the $4.5 trillion tax cut, they're taking $700 billion away from Medicaid. And the reality is the savings that they're getting is from kicking people off Medicaid, which is just horrible. And I know that you know how important Medicaid is for your constituency. And I can tell you for my constituency, when you think about our nursing homes, 65%, over 65% of our nursing home are filled with Medicaid beneficiaries. And I know you know this too, but the fact that most of the births in Alabama, most of the babies that are born in Alabama are born through Medicaid. So if you had a big slash in Medicaid, would that be detrimental to Hill Hospital?
Absolutely. I mean, without question. And I say this to my staff all the time. If we talk about this bill, if Medicaid is not go away, if it's just reduced, if it's slashed, I can't tell you that I would have a fight in me to continue this journey. I would say to everybody, I think we've done a tremendously good job. But if because our hospital functions solely off patient care.
Yep.
We get very little funding from our county. Thankfully, in the past, we've been able to get some funding through our trust fund board.
Yep.
We're so appreciative to them for that. But that's not a long lifeline that we
Yep. It's not a long-term plan. Yeah, you're right.
Long-term plan. And so if we don't have Medicaid, if it's just no way. I mean, I don't know any other luxury way to put it. It's just the hospitals are not going to survive. And Hill Hospital won't survive. And I can promise you some of the other hospitals that are urban hospitals, they're going to see the effects of it too, because if I am not here, then they're going to get those patient populations that I get who don't have the means to pay.
Right.
Who just wait until an emergency happens to come to the emergency room. You're just going to have those who don't have health insurance. You're going to have those moms who's at home in the middle of the night who's pregnant, who need to be at a hospital or somewhere to get that immediate care to get them to a higher level of care. If
Right.
we are not here, it will be detrimental not only to the individuals, to the ambulance services, etc. So there's a big picture here that I think we are just not taking in consideration. It you don't want to lose your healthcare. So I think everybody needs to be screaming, rural, urban, everybody needs to be screaming.
Absolutely. And what's interesting is that one of the statistics, because I've been fighting for Medicaid expansion for Alabama. I know you have too, and so has our hospital association and others, and healthcare professionals, because you all know how important it is. But we shouldn't be surprised that 80% of the hospital closures over the last 10 years have been in states that did not expand Medicaid.
That's right.
80%. And so when you couple that with the fact that now this bill wants to cut the largest cut in Medicaid history, $700 billion for Medicaid, it will be a huge blow to healthcare services in our state, but especially hit hard will be our rural hospitals. And we
Yes.
know also that the first thing to go is often the obstetrics units. Oh,
Mhm.
and so I know that you know this, that we sort of lost in Marengo County at Bryan Whitfield. I mean, so often rural hospitals are shedding essential obstetric services in order just to keep their doors open. And it's pretty frightening if you're a mom,
It
especially a
is.
first-time mom,
It
and
is.
you're trying to schedule when your baby is being delivered. I mean, really, that's very hard to do.
So, I was looking at some of our numbers
Mhm.
and I was looking at, okay, if Medicaid go away, what does it look like? And
Yeah,
so
what does
looking
that
at
look
our
like?
numbers, which when I look at numbers, I said we're already at bare
Yeah.
bones here, right? And so if Medicaid goes away, we stand to lose about $5 million a year.
Mm, mm, mm.
We
That's
can't
a
stand
lot.
to lose that. That's a lot for us.
Oh my God, that's
Patients
a
go,
huge.
our volume is
Mhm.
low. And so, but that's a lot to lose for us, almost $5 million if we don't have, if that's any reduction anywhere. So it's just so vitally important that we reconsider this bill for any
Yeah.
cuts, as a matter of fact.
Well, I'm hoping that by letting my constituents understand the importance of Medicaid and Medicare and the government funded health insurance, these should not be in the crosshairs of being cut to
Mhm,
give tax breaks for billionaires and
mhm,
millionaires. And I say that because when you look at that bill, if you make $50,000 a year by having this quote unquote tax cut, do you get a tax cut? Well, yeah, but your tax cut is $200 a year. And if you lose your health care and you lose your food benefits because they're taking SNAP, they're cutting SNAP by a
mhm.
dramatic amount of money as well. I mean, there is no net benefit for someone who's making $50,000 a year or under, just not. And the same bill, if you make $1 million a year, you get a $80,000 savings. So that's why I say that this bill is not about helping ordinary Americans, hardworking folks. And I say that because on top of this bill, the Trump administration has already announced that the subsidies that we Congress extended for the Affordable Care Act, those expire. Those subsidies that allow for people to get their own health insurance on the exchange at a reasonable price, those subsidies expire December 31st. And so if you think about it, this bill goes into effect next year and you don't have the subsidies and our rural hospitals are already suffering. This is a triple whammy to the people that I represent and that you serve and the community that you serve. And it really is, it's hard to stomach. I voted no when it was in the House. Actually, Loretta, I voted hell no. I was the first one on the floor to vote no, 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 no,
Yes.
because it would be horrible for my constituents. And Republicans talk about how, oh, but it offers a tax cut, a tax break. Well, if you are poor already and you make very little money, especially if you're on Medicaid, that means you probably don't even file a tax return. You know that, right?
Absolutely.
So this is just, I mean, this is not, this is to the real world. This is not a benefit. And I had my staff look up how important hospitals are in terms of workforce. We haven't even talked about that. I
Oh,
mean, when you
no.
think about the fact that you have good paying jobs in your hospital, that people in there in our community can, pay for their children to go off to school, and I mean, healthcare is the sixth largest employer in the nation. And
Absolutely.
oftentimes in rural communities, it
It
may
is.
be the biggest employer
Yes.
of that community. And so we're not just talking about the closure of hospital, we're talking about the loss of livelihood for so many people. Can you talk a little bit about what that would mean to York and what that would mean to Sumter County?
Well, something. Let's just say York, right?
Yeah.
So York is Hill Hospital is probably, like you said, the largest employer here in York, Alabama. And let me tell
Mhm.
you, I think we have a bond issuance, right? And so if we lose this hospital, then who's going to pay that?
Oh yeah.
Who's going to
Who
pay
are you going to pay
that?
back?
Falls
Yeah.
back
Who's
on the
going to pay back
city.
that debt?
Yeah, who's going to pay that debt? That will fall back on the city, who's struggling as
Yep.
well to survive. So it would just be detrimental. Okay, so the individuals who work here, right, they would have to travel to other
Find
locations.
another job. Yeah.
To find another
If they
job.
can find another job.
If because and then when I say if, because our employees here, I would say 40% of our employees who work here has been here over 40 years.
Yes.
And so they're
What
looking forward,
dedication.
yeah,
Yes.
and they're looking forward to going home, not
Yes.
traveling anywhere else. They're looking forward to being able to say, I made a huge impact because of my commitment to my community, to my home state. I stayed the course, even when COVID was
Oh,
offering so much money for travel. They stayed here. They
yes.
they
Yes.
didn't just jump ship and say, I want. No, they're here because they love being here. So the workforce would be detrimental here. I mean, let's even talk about some of the other rural health clinics who depends on this hospital
Oh, yeah.
for lab services, for other outpatient services for their patients.
Yes.
How they would struggle if they would be able to sustain without being able, because they're sending their patients 30 miles or more down to another facility or another hospital for a test that they could get here.
Yep.
And so yeah, that workforce would be impacted tremendously. The economy would suffer.
Absolutely. And I mean, it has a ripple effect, doesn't it? So that if you lose your hospital, the employees lose their jobs, the economy loses consumers
Mhm.
and then all of a sudden you're in a community that can't bring in economic development because one of the drivers of economic development is also the hospitals.
Exactly.
And so, I think we can say, we say, oh, hospitals are the lifeline. But when you're in a rural community, I'm here to tell you it takes on added importance because we know that people can't just, pick up and move. And we know that with every high school graduating class, rural America loses population.
Yes, it
And
does.
so you add to that a dwindling tax base.
Mhm.
And, it could be really, really devastating. And,
Let me
I
say,
am just,
it's already devastating. I mean, when you
as
just,
you
I
said,
mean,
it's
just there,
already hard to keep
it's
your doors.
already hard to keep. It's already hard to get businesses to come into not just York. It's just hard to get businesses to come into Sumter County, period, because
Yes.
that's going to be a conversation. What's your education system like?
Yes.
What is your healthcare system is like? Someone want to know what type of churches do you have,
Yeah.
because of their religious
Yeah.
background. I'm
Mhm.
just saying everything, like you said, ties into everything. There's a connection somewhere. So if any link is broken, the system itself gets off track, and at some point it dissipates as well. So I'm just saying, healthcare just has to be that primary concern, because so many people, and I just have to say this, we talk about our older population, we talk about our children, but I want to focus on our children a little more. We're
Yeah.
seeing even in communities where, because we see so many people who end up at our emergency room with no means to pay for care. So what we do is we say, let's dispatch our nurses into these communities and let's do some health screening so that we can identify individuals before they come to our hospital. But what we are identifying are those children who have type 2 diabetes,
Yes.
who are obese, and who parents, they don't have health insurance because they fall outside of that chip bracket. So we are concerned about those also who ends up in our ER, with a catastrophic illness that they didn't even know that there was an underlying root cause to it, because they didn't go to their primary care physician because they did not have the insurance. Or
Yeah.
mom and dad could not get off work because they could not miss another day. It's just a lot of things that we could talk about in that area, especially when you're talking about rural healthcare and rural access, that without it, it is.
Absolutely. And you bring up a very valid point. When I talk to my constituents, especially in the urban areas, and that you talk about rural hospitals and they kind of glaze over. But I mean, how I explain it is the fact. The fact of the matter is, taxpayers, hospitals don't turn people away. So
No,
whether they have insurance or don't have insurance or is underinsured, you come to a hospital and you are going to get treated, and that treatment will have a cost to it.
absolutely.
And so, as you said, I mean, we as taxpayers are going to pay for it one way or another, and I would rather pay for it on the front end in prevention and in giving people an option, a reasonable option to get their own health insurance through the exchange, the Affordable Care Act, than to wait till end of life treatment, which is oftentimes quadruple what it would have been, right?
Mhm.
And so those costs are borne by us, the taxpayer. So when we talk about the closure of hospitals, and especially in rural America, what
Mhm.
we're saying is the taxpayers are bailing out people. We pay one way or another. We as Americans do.
Absolutely.
And
Absolutely.
it baffles the mind that we see in a lot of industrialized country. Healthcare is seen as a basic human right for every citizen and not just for the privileged few. We haven't gotten there, but I can tell you that when my first operation I ever had was my appendix burst when I was studying abroad in London, and I'll never forget calling my parents from the hospital, and the first thing my dad said, Loretta, was, "Do they accept Blue Cross Blue Shield?" And I said, "Daddy, no, they don't accept Blue Cross Blue Shield." And I said, "But Dad, they have public health here, and so you're not going to get a bill. Yes, I'm a visiting student from America, but I am enrolled in one of their institutions, and they're not going to charge me." My daddy waited month after month for that bill to come, and it never
Absolutely.
came. And so it really taught me that there are other ways, there are other systems in the world that figure out a way to provide every citizen with quality, affordable health care. And we in America have the rising cost of health care. It's just gotten out of whack.
Mhm.
And because of that, it imperils our rural hospitals even more. But I know our time is drawing near, and I just wanted to just say, Loretta, thank you so much. I hope you tell the employees at Hill Hospital, from the depths of my heart and my constituents, thank you, thank you, thank you. I did see, you know, through all the struggles, the fact that Hill Hospital is still standing is a testament to you and to those amazing employees who are willing to get cuts in their own salary just to meet payroll and to provide health care for the community. And I hope I've done my small part by trying to get you guys money
Oh,
for
yes.
equipment
You have.
and the like. And I hope you know that we will continue to fight for the health and well-being of our citizens. And so my last question to you is, if you could speak to President Trump, and the senators who are now considering this big bill right now, what would you say to them with respect to the cuts that this bill currently has in it that would cut Medicaid and health services?
I would say, if we are considering making America healthy again, there is no way we're going to be able to do that if our people, whether you're rural or urban, black or white, if we do not have access to health care, if we do not have rural hospitals or hospitals in general where individual can get the care that they need, there is no way America will be healthy. So let's think about the big picture. And the big picture, we are people. We deserve the best that America has to offer to us, regardless again of our status. That's what I would like to tell, get over to President Trump and the Senate, anybody.
Well, all I can say is amen. What a great way to end our Terry talk. I think that for me, especially when we're in the minority and Republicans control the White House, they control the Senate, the House of Representatives, and they control the judiciary. So they control all three branches of government at this point. And it's like fighting with both hands tied behind your back, but I still got a mouth and I still got feet. And we're going to continue to talk and make sure we're educating my constituents on what their legislation and their policies mean to them. We do it when the Democrats are in charge. We're going to do it when the Republicans are in charge. I think that my job stays the same, irrespective of who's in the White House. My job is to provide better opportunities and more resources to the amazing people of Alabama's 7th Congressional District. And we do that by working with whoever's in the White House, where and when we can. But we also have to expose wrong when we see wrong. And I'm sorry, this bill is not a big, beautiful bill. It's an ugly bill that will do detrimental damage to our hospitals. And so I want to thank you for being my guest as we talk about saving our rural hospitals. And so I wanted to give you the last word, but I wanted everybody to know that I think my takeaway, I hope the takeaway from today's Terry Talk is, take your hands off my rural hospitals. Take your hands off of Medicaid and Medicare and all those essential federal benefits that help people. And so many of the people that we're helping are the working poor. They are they make too much money to be on Medicaid in Alabama, but they don't make enough money to be able to afford their own health insurance. And so many of these people are working 40-hour a week in jobs that don't offer them health insurance and that pay them minimum wage. And so we just need to whom much is given, much is required.
Absolutely.
And I want to thank you for what you do every day. Any parting thoughts?
Well, I want to say to you, thank you for having me. And as you was giving your final thought, I came across a song that just really came in my mind. And of course, I'm not going to sing, but I want to say, and I know you know attorney Rose Sanders.
Yes.
When I was small and I was going through her youth programs, she taught us a song, and the song say, "I want to lift my people up; they are not heavy. Because if I don't lift them up, then I'll fall down." That's the way I feel about this whole situation. You have to lift each other up, because if you don't, you'll fall down. May not be today or tomorrow, but eventually you will fall down.
What happens to one of us can and does have an effect on all of us. Thank you so much, Loretta Wilson, the CEO and administrator of Hill Hospital, for taking the time out of your busy day to educate us on why it's so important to save our rural hospitals. To my constituents, stay tuned for the next Terri Talk. Thank you.